Hi, we're here at the Health Leaders Revenue Cycle Exchange at the Omni La Costa in Carlsbad, California. I'm Julie Otten with the Health Leaders Exchange team, and I'm here today with Heather Kawamoto, who's Vice President of Strategy at Waystar. Welcome, Heather.
Thank you. Thank you so much. Glad to be here.
We're going to be talking about just the patient payment space, and what's going on there. So, can you kind of give a industry-wide view of patients and what they're doing with payment these days? We've got rising healthcare costs, rising healthcare premiums, as well as high deductibles. We've got higher copays, and then we have the overall inflation. So, tell me what y'all are seeing in terms of patients being able to pay their bills.
Yeah, I think you really hit the nail. There's a lot of factors that are impacting that. And unfortunately, healthcare is often one of the first things to go. So when patients have, unexpected expenses like a job loss or, their car needs repairs or they need a new furnace, healthcare is one of the things that they go. And we've certainly seen, Gallup did a poll that was just released in January that showed that 38% of patients didn't have care last year because they were concerned about the cost. And that was up 12% from the previous year and the highest they've seen on record.
Yeah, that's significant.
Yeah, it's really alarming. And we know that that has ripple effects. When patients don't get care, sometimes if they have chronic conditions, it gets worse. And so that's really the last thing we want to see is that, patients don't seek the care they need because of the cost. And you also, mentioned the cost shifting from patients. They're seeing higher deductibles. That's also the larger macroeconomic climate. As employers are feeling the, inflation pressures, they're trying to keep premiums down. And so they shift more of that cost to patients. And I know the Kaiser Family Foundation's most recent employer survey put, a high deductible health plan for a family, they're looking at on average a $4,700 deductible.
Wow.
And that's well in excess of what most Americans have in their savings account. And so we see two things happening. Patients either skip care, which impacts the provider's revenue, or they have the care, but oftentimes it's increased bad debt or it's increased cost to collect. So it's really a very challenging situation for patients, but also a really challenging situation for providers as well.
Wow. So more and more patients are wanting to know what their total bill is going to cost. They want to know up front. They need to know an estimate for the cost of care, and which is understandable. We get estimates for when you're going to go buy a car. You kind of need to know.
Yeah.
But yet determining that cost can be a real challenge because there's so many factors and some unknown factors. So what do you recommend for revenue cycle leaders to be able to pull that together, to be able to really give a strong estimate without scaring patients off also? So
Yeah.
it's kind of a dual thing they've got to deal with.
Right. I think up ahead of that, we have to recognize what's at risk when providers don't do that. So, HMA, the Health Management Academy, puts the lifetime value of a patient at $1.4 million.
Okay.
So every time a patient decides, I don't get transparency of how much it's going to cost, I can go to another provider. That's $1.4 million in the lifetime that's walking out the door in terms of
Wow.
revenue.
Yeah.
And so that's why, I think 94% of healthcare executives said keeping patients is their number one responsibility or priority right now. And that's because in 2021, they saw a 17% decrease in revenue from patient leakage, from network leakage, where patients sought care elsewhere.
Is part of that though the fact that they didn't understand
Exactly.
how much they were having to pay? So
Yeah.
really,
Yeah.
that deterred them
I
from.
think that is the number one factor, is that patients want to know. They are already concerned about their whatever the health issue is that they're
Right.
undergoing.
And then the financial pressure and stress on top of the health issue,
Yeah.
it just exacerbates the whole
Yeah.
situation.
Yeah, and you mentioned it. It is hard to do the estimates, but estimation products have been around for well over 10 years. I mean, really probably about 15 years ago, they started to come onto the market. But you caught it when you said the accuracy of the estimates. And I
Right.
think that is something that providers can't let up on. And whether you're using the estimator in your EMR, your practice management system, or you're using an estimator with a third party, looking at making sure you're really understanding what that accuracy is, because there's a twofold impact. If a patient's asked to pay more than they ultimately it's going to be on the claim once it's adjudicated, or less, and then you have to go back to them and ask for more money, the next time you go to ask, if they come back, they're not going to want to pay.
And the trust factor
Yeah,
too.
huge trust.
Yes.
Yeah.
Okay.
And then there's the trust with the staff. The staff will be less inclined to ask for the money because they don't want patients saying, well, last time when you asked me, it was wrong.
Right.
So it's a double trust issue. I think that there's more information available about, price information is more readily available. The good faith estimate that's part of the No Surprises Act, I think ultimately is going to serve as a forcing function for providers, as painful as that might be. But what the intent is to give patients a much bigger picture of what that ultimate out-of-pocket cost is. It's not just the hospital costs. We've gone in and we've gotten hospital costs, then 60 days, 90 days, 120 days later, we get the radiologist bill. This is really meant to try to get the healthcare providers working together so that patients have that view. But that's only step one. That's one piece of the puzzle. The second piece is, once you've given a patient a number, then understanding what are their options.
Right.
You know?
Right. And that is significant because you don't want them to be so scared, but you need to say, this is doable.
Mm-hmm.
We can help you.
Yes.
And okay.
Yeah. And we had one provider that said, asking for $1,000 for a patient that can't afford it might as well be like asking for $10,000. And so providers are starting to recognize that coming up with technology, be it, payment tools, and there are tools out there that can help patients devise a payment plan or look at medical loans, or how do you get them on a charity plan. There is a host of options available. So it's not just about giving a patient an accurate number, but it's following that up with, now here's how we can work with you in a way that is good for you and good for us.
So you really become more of a partner, someone who really cares to help them,
right,
versus just demanding payment. And so instead of that face just saying, this is the astronomical bill or whatever, to them it may be astronomical.
Yes. And here's how we want to work with you.
That's right.
Yeah.
I think I've already caused about $1.5 million and so far. I have more to go. So CVS and Walgreens, some of these competitors, they are really capturing the consumer space. What is it that they're doing that revenue cycle leaders can learn from?
Yeah. So last year, in the second half of last year, those organizations spent $15 billion in healthcare investment.
Wow.
CVS, Amazon, Walgreens. Healthcare is almost 20% of our GDP. $1 in $5 in the US almost goes entirely to healthcare. They're looking at this as a huge business opportunity, and they're not.
It is.
And it is. And I think where there is some challenge is that those businesses have been built completely with the consumer at the center. They're consumer-centric businesses. And that is resulting in providers having to step back and look at, how do we engage with patients more like they're a consumer? How do we make this a better experience? So, at JP Morgan this year, digital front door is no longer a novel concept. People are purchasing, large health systems are purchasing CRM systems, customer relationship management, because they realize these people, like I said, the $1.4 million, these people are worth a lot of money to the health system. And so we need to engage with them in a way that is meeting them where they are. I think we can't lose sight of the fact, though, that providers have a real advantage here that I think is being overlooked. They have a trust. They have a level of trust with their patient. And we all know as patients, we trust our provider. We
Right.
largely look to them. That's why, insurance companies have had price transparency available on their website for their members for years. I mean, 10, 15 years. You could go out to United and get, if you were a United member, you could go and get an estimate. But nobody does because they don't trust the insurance companies like they trust their provider. So I think that's one thing that providers can't lose sight of, is that they ultimately have that trusted relationship with patients. But I think if providers aren't quick to recognize that this is an opportunity to rethink how they engage with consumers, convenience may ultimately become a bigger factor for.
And tell me about that. Why is it more convenient for me to go to a CVS than for me to go seek a provider?
Yeah, I mean, we're seeing it. I certainly, I've seen it with, I go to schedule an appointment for my kids, and to get into the PCP can be a month out.
Right.
Unless there's a really urgent medical situation, it can be a month out. You can probably go to a Walmart clinic and get in 3 or 4 days.
Wow.
And so I think there needs to be a reevaluation of what that load balancing is, and providers are investing in more outpatient settings so that they can move patients out. They don't all have to direct them through the hospital. But that's where I think the rub is, that those organizations don't have the volume that large health systems do. So at this point, they're still building up that network of patients. But right now, it's very convenient for patients if it's not a significant issue. And we certainly see that millennials don't have the level of devotion to a given provider.
Right.
They're just going to go wherever it's easiest and quickest for
Where
them.
it's expedient.
Yeah.
But what about the payment? They also make payment a lot easier, don't they? Haven't they simplified
Yeah.
that? Like click.
Yeah, because that's how their companies are constructed. They've been constructed. We know how easy it is to make a payment on Amazon.
Right.
They already have our
Right.
card
Click away.
loaded.
Right.
And so that's where providers are stepping back and saying, from that holistic patient engagement perspective, what are all the aspects? How do we meet patients where they are? How do we make this a less frictionless experience? Because that's what patients want. We all got used to that during COVID.
So what do patients want? Like on top line, what are the things that they...
Convenience.
Okay.
And they want it to be easy. I want to be able to go online, find a time that's available based on, where the provider schedule it. Maybe it's 11 o'clock at night. Once I put my kids to bed, I want to pick that time. I want to do everything. I don't want to get a clipboard when I go.
Right.
I want to do everything online. I want to store my card. I want you to already have, processed everything beforehand. That's what we've all come to expect. And that's where I was saying, I think COVID really accelerated that. We all got used to everything being easy.
Somewhat. I mean, it's still, they still handle a lot of paper. It's amazing how I can fill things out online and still show up, and they still want me to fill the same thing out with paper. It's like, what is this? Did I not fill it out?
Yes.
Why again? But you don't have that experience when you go to like a CVS or any of that. So, and what about the payment? Is that, also it can be very frustrating paying a healthcare bill with a provider.
Yeah.
So why have they made it so easy? How are they doing it that we're not?
So they aren't doing the level of acuity that a hospital would. So that is part of it. Most of them aren't doing, complicated inpatient, surgeries, or even really in many cases, ambulatory surgeries where they're doing, a knee arthroscopy or a rotator cuff repair. Those are more complex. It'll be interesting to see once they start to expand into that area, how adept they are at applying the technologies that they have today around payments and sort of processing patients, if they're able to, to account for that. But I think that is part of why providers, struggle with that a little bit more.
Well, Heather, what do you see for the future? What's some future trends that we're obviously growing more into a technology space? Also with the shortage of the staffing has been a real issue of keeping people, training people, staff turnover. And so many revenue cycle operations are trying to digitize so much of their operations. Is this just a continuing trend just because, frankly, because of employee issues, among other things? But tell me kind of what you're seeing
Yeah.
as how this area is evolving.
It's interesting. I saw a quote in the latest Keckley report that actually was from Winston Churchill that said, "Never let a good crisis go to waste." We sort of saw that with
My daily life.
we saw that with COVID.
Yeah.
And I think we're in a near crisis situation with providers for the reasons you mentioned. Month after month of negative operating margins. We're seeing competitive threats that we just talked about from payers who are trying to get into the provider space, from
Right.
other providers trying to attract those patients, from those retailers, and then the clinician burnout that you mentioned. And as bleak as that sounds, I think there is a real bright spot for what you touched on is, and we're hearing it, the generative technology with ChatGPT and artificial intelligence and machine learning. That is advancing in a way that I think at a pace that we are not even appreciating now. And we're starting to see that come into the revenue cycle. And that it comes at really an opportune time because we're in such a challenging situation with retaining staff. And there's two things that occur. If you can alleviate a lot of that manual processing, if you can use technology to do that, I say nobody gets into healthcare to be on the phone with an insurance company asking about an authorization.
Right.
That's not why they do that.
Right.
They want to work with patients. They want to make a difference. And so if technology can do a lot of that manual work that's important, I mean, we need to make sure that we produce an estimate for the patient. We need to make sure that their authorization's been secured. That frees that staff up to do something that they really are going to enjoy doing, is more impactful, it's more meaningful. Big retention. I mean, that's a way to retain staff is by making their job easier. It's also a way to retain patients because you're serving information up more readily. Texting a patient, here's what your estimate amount is for your service that's coming up. Your authorization hasn't been secured yet. There's a risk that we may need to reschedule your appointment. All of that technology that can do a lot of that for them, that automation, as you were mentioning, that's right there. I think we're right at the precipice of this coming at such a perfect time when we're really seeing a lot of the struggles that we've talked about.
And not only that, but having this technology to be able to alleviate a lot of mistakes that can be made because it's already in the system, correct? And so that helps with denials.
Yes.
It helps a lot with, talk about that, of the technology helping of just getting paid, getting more money.
And that's what machine learning does, is it learns. And that's the whole idea behind it, is where can we start to see where these payers use different rules. And we see this in accuracy of estimates. We see that when it's this particular department of the hospital, that Humana actually uses a different benefit code than other payers do.
Right.
That's something that a system can identify and account for, correcting the estimate. Nobody has to find that. An analyst doesn't have to go through and see that variance. A lot of that will ultimately make the denials less pervasive when we can catch a lot of that data quality and those elements up front. And that's what it's meant to do. It's meant to see those trends in data and automatically account for it.
Wow, that would be extremely helpful. So, Heather, any other tips that you have for revenue cycle leaders for them to be just paying attention to in this space?
Yeah, I mean, I think we certainly, and not to completely plug your event, but this is a perfect type of event where I think providers need to hear from other providers. And we see I love when I can connect a provider on the phone and say, you know what, there is another organization that is having this exact same challenge. Talking to other providers, I think, is the most important thing that they can do. And sort of understanding what worked for you, what vendor has worked for you, what did you learn from the process, because that is, and is it really a one for one? Are you an academic medical center or are you a critical access? I mean, finding somebody that's like for like, that you can see what have they done that works is a big factor of, so that when you do work with a vendor, you can say, here are things that we've heard from other providers that have made that experience better. That strengthens the partnership right off the bat.
Right, and that's really critical.
Yeah.
Well, thank you so much for your time.
Yeah.
This has been fascinating, and I know that revenue cycle leaders will enjoy what you have to say during their exchange. So
Yeah.
thank you, Heather.
Absolutely. Thank
All
you.
right. Thank you. That was great.
Yeah.
Sign me up.